This is the place. As someone who struggled with chronic pain and discomfort, finding relief seemed like an endless battle. But then I discovered Dr. Darren Berry at 100% Chiropractic and everything changed. Walking through the door, I entered a realm of hope and healing. From the moment I stepped into the welcoming atmosphere, I knew I was in good hands. It has been a journey of transformation where Dr. D's skilled hands and compassionate heart work together to restore balance, alleviate pain, and ignite a newfound vitality I thought was gone for good. This isn't just a clinic. It's a sanctuary where healing thrives and lives are changed. Welcome to my haven of wellness. Well, I'm here at 100% Chiropractic with Dr. Darren Berry, as I call Dr. D, who is also my chiropractor, and I love him very much. And I want to thank you so much for taking the time out to have a chat with me.
Of course.
And what I wanted to start with first is just give us a background,
Sure.
a history of your educational background, and really what was the impetus for you to want to even become a chiropractic doctor.
Okay, so things really kicked off. I grew up playing soccer. So I played soccer from age 4 seriously until about 17. Grew up without a lot of access to healthcare in not a particularly affluent area of Maryland. Was on crutches every year because of my ankles between the ages of 9 and 18. And was very close to being able to play soccer in college until I broke my foot my junior year of high school, lost all of my scholarships in about a 48-hour stretch, and then was left trying to figure out what I wanted to do. And so initially, I went to Penn State and was a chemistry major thinking I'm just going to go to med school. Why not, right? I got one semester into being a chemistry major and decided I did not want to be a chemistry major any longer. So bounced around a little, was an athletic training major for a while, did that for a year and a half, realized that athletic training was fine, but I didn't particularly enjoy the egos of those with whom I was working. Had a bit of an identity crisis for a while, spent a semester competitive ballroom dancing at Penn State, ended up transferring to a school right outside of Baltimore called Towson. Finished my degree there in exercise science, but in the course of doing that was torn for what comes next, because you don't really get an exercise science degree on its own unless you really want to be a personal trainer, and I did not. So I ended up being torn between physical therapy and chiropractic. And where chiropractic really clicked for me was that I wanted to make an impact for somebody quickly. And so I ultimately decided on chiropractic because somebody could walk into my office and I could put hands on this person and affect them physically right then, knowing that they were going to leave that office in a better state than how they came in.
And I can attest to that. I can definitely attest to that.
But that part, for me in particular, was very important because growing up with almost no access to healthcare, no health insurance, and someone who was on crutches every year, I mean, I can't tell you how many $4,000 to $7,000 hospital bills I received in my childhood for nothing more than an X-ray, a cast, and a pair of crutches. And so for me to go through that, I wanted to be able to make an impact for those who really needed immediate change without having to spend exorbitant amounts of money for that change. Ended up going to chiropractic school at the Palmer College of Chiropractic in Port Orange, Florida. And the rest is pretty much where we are now.
So what are some of the common conditions that you see more often than not?
Sure. So the big 3, neck pain, low back pain, and headaches would tend to be those.
Okay.
Headaches for me in particular are the sweet spot.
Okay. Now, in looking at it in terms of the headaches, how do you go about diagnosing how do you go about diagnosing, and once you do diagnose, how do you develop a treatment plan?
Sure. So diagnosing headaches is not really done correctly often. We tend to find diagnoses are more symptomological rather than actually examining at what the causes are. And so what I find more often than not is people come in with a lot of misconceptions about what their headaches are. Big one being migraines, right? But migraines, by definition, have to do with the blood vessels in your brain. And so unless very specific examinations are done, like an angiogram of your brain or a CT scan, under very specific conditions, migraines then are not what people come in with, right? They are a type of headache, not a severity of headache. And that's really where the gray area becomes. And so for me, what it is what are the possibilities of what these headaches could be? Because when I have somebody laying in front of me, if I can press into a tight muscle and I can replicate their headache symptoms, I can tell you exactly what causes your headache. Right? A headache caused by a muscle is a tension headache, no matter what it is. Even if it's dark room, lights off, ice packs all over your face, nausea, it is a tension headache if it is caused by a muscle. And then different muscles refer pain to different places on the head. And so by listening to patients for where they feel their headaches on their head, you can get a really good idea of what muscle is the problem. Now, the next step is, well, why is that muscle causing this problem? And that's where the differences have to be, because the only reason muscles truly get tight are if they're being overused. Why is that muscle being overused? Well, that means your body is recruiting that muscle to do a job that is not implicitly their job. Right? So it's compensating at best. If we can then identify why it's compensating and from where that problem arises, very often we can resolve headaches or at least tremendously reduce the frequency and severity, which for people who have had headaches more than once know that that's a big deal.
And it is a very big deal. It's a very big deal. I can say personally for me, just taking into consideration, okay, my age and the conversation that I had with myself prior to meeting you was, okay, I'm just getting older and my hip is just going to hurt and my knee is just going to hurt. And sometimes I'm going to have to sit there and convince myself that I have to put both my feet on the floor and get up and go get things done. I'm just going to live with this pain. I think that that might be the way a lot of people feel until they understand that this is, you told me, this is not that. Mm-hmm. I remember I was saying something about, I'm just, it's my age, and you're telling me, no, that's not it, Ayan. There's something that's that's going on that we need to address. And I like I said earlier, from just my first adjustment, and it took 10 minutes. Mm-hmm. 10 minutes, and I'm at home, and I'm like, hey, let's go walk the dog. Let's go do this. Let's go. It's real. It's serious. And I was doing a little bit of research, and I was very, very, very. It's very interesting to find out how many different things the spine affects. Mm-hmm. It's incredible. So I know you have different techniques. I know that I use a few of my use attention at home. Mm-hmm. How do you go? How do you? I'm so curious to find out, how do you analyze, I guess for lack of a better word, which person needs what? I know, like with the particular tension that I use at home, one could use it one way, mm-hmm. where it's more conducive to the arch of the back. Mm-hmm. The way that you have me doing it is not, mm-hmm. but that's the way that you tell me to do it, so that's what I do. But so what process do you go through to determine what's needed?
Sure. That's a very long answer. The simplest way to put it is by looking at your x-rays. I can measure very specific angles, which are all established normal ranges based upon research. That research is conducted by the technique that I practice predominantly, which is chiropractic biophysics, or CBP. That analysis technique is what allows me to analyze the spine, not just as a spine, a neurological structure, but also a mechanical structure. The understanding is that the structure is what dictates the function at the end of the day. And so when you can analyze the curvature of the spine, not just region by region, but even vertebra to vertebra, you can really gain much deeper understanding of mechanically where that failure point is. By understanding that very specific mechanical failure point, you can actually go one step further and say, okay, now you've isolated, let's say, a 2 vertebra region. Well, what nerve comes out from between there? What nerve root? Because that nerve root will then become tons of nerves, billions in some cases, right? What do those nerves do? How do those manifest symptomologically? So that really we can start addressing the body as a whole system just by changing the biomechanics of the spine itself. And so that's where things vary person to person. More often than not, The human body knows what to do. It knows how to fix itself. But the only way that that's even remotely plausible is if your brain can actually tell that part of your body what to do and when to do it. That structural change affects the communication and the ability for your brain to fundamentally be able to have that conversation with that part of the body. And so we see decreases in function over that time. You start to affect the structure, now you can affect the function. The human body takes care of the rest. I just facilitate the structural change.
And you do a good job. You do a good job. I also wanted to know, do you have the option or the opportunity, rather, to collaborate with other medical professionals?
Sure.
And how often do you do that?
It really depends on the person, but I mean, yeah, absolutely. There is an orthopedic surgeon who I do work with when the case just simply isn't a chiropractic case. I can help everybody, but that doesn't mean I should be the first person to help them. And that simply does happen. You know, there are scenarios where I should not put hands on them until we know that something is addressed. So I can do that, but I mean, I have a stretch therapist in my office, and she's wonderful. Massage is incredible. I love naturopaths. I have a very specific group of women who look to address their hormones as naturally as possible, so that preserves their effectively fertile longevity, is how they put it to me. So there's always opportunities. Gosh, I mean, there's a pelvic floor rehab center not too far from here who we've been trying to set stuff up with for a long time, but you know, she went and had a baby, so that tends to take precedence
Yes,
to
it does. Yes,
business marketing. So, you know, it is what it is. But yeah, there's always opportunities. I am certainly not a catch-all. My only caveat is that I just want whomever I'm speaking to engage appropriately.
that was going to be my next question, because I know from the time that I've been coming to see you that you are very, very big on patient education.
Mhm.
And I think that is just so important that I think it's wonderful that you are so interactive
Mhm.
with the patients. I sit and watch you, prior to my adjustments, and I know how you've, interacted with me, and it's always very informative. And the one thing I have noticed is that, which is rarely seen, is that you are so down to earth.
Mhm.
You're very down to earth, and I think that puts people at ease. And I was curious, and I wanted to know: is that part of your training, or is that just your personality?
No, that's just me.
I thought so.
Yeah.
Yeah.
Yeah, no, that's me. Because what I decided upon opening a business is that I want to be me, which, as simple as that sounds, is really not, because there's me at home, and then there's the doctor version of me. And as close as I can bring those two versions together, the more at peace I can be within my own practice. Because if I'm going to build and grow a practice and affect the community, well, there has to be a certain degree of give and take with that, because I am going to pour myself into whomever is in front of me. If that person is implicitly a taker, then this becomes a very exhausting process with not a lot of longevity, even remotely possible. And so the more like me I can be, the more I will draw people to me who feel very similarly, or who I can at least have reasonably productive discourse. Right? I can help anybody, and I want to help everybody. It's simply the matter of, am I the right person for you, given what exactly you're looking for?
Exactly.
And in some cases, no.
It's basically, I would say it's the energy that you're projecting is the energy that you want in here.
Correct.
Okay, got it. So what do you do? I know a while back you had to go, I believe, to Vegas.
Mhm.
So what else do you do to stay informed? Because in any area of medicine, I know there's just constantly new things, there's new technologies and
Mhm.
new ways of doing things. And what is your way of staying abreast of, the new happenings in chiropractic medicine?
Sure. So that Vegas trip was actually for the company at large. All of the doctors in the company get together. We do business presentations to some extent, but it's really just to get your mindset right, stay grounded, keep remembering what all of us are doing this for. But as far as chiropractically, outside of your biennium continuing education you have to do, I just read the research, and that's really all it comes down to. I mean, practicing the technique that I do, they are constantly publishing research in major medical journals. I mean, just 2 days ago, they had a journal article that was accepted for publication in the Journal of Clinical Medicine, which is like up here in that world. But you have to read it. Knowing that the research is there is completely irrelevant if you don't read it, and then take the time to understand what exactly that means and what are the implications on what can I do for people. Short of that, I mean, there's plenty of other things. Like, you always research into new modalities, things like class 4 lasers, things like that. But for me, it's just read the research, learn new ways that I can apply the things I'm already doing so that I can, one, improve clinical outcomes, but two, I can just help more people. That's really what it comes down to. I just want to help more people, as many people as I can.
Do you have any amazing success story that
Oh, goodness.
yes, that if anybody ever asks you what was your favorite patient, or not really favorite patient, but your favorite outcome? Something that was really a success that when you first looked at the patient, you were like, oh my God. And all of a sudden over time, you're like, oh my God. You know?
So she's currently still a patient. She walked in on her first day, kind of. That's a very generous thing to say. She came in on a walker. Her husband was holding her up. And this poor lady, I mean, she's seen the worst of it. 2 ankle reconstruction surgeries, fell out of a plane onto a tarmac. I mean, we're talking about the whole nine, and then COVID hit, and she was stuck in a chair for years because she couldn't leave the house. So she didn't leave the house, and she didn't really leave the chair. Well, then, if you don't use it, you lose that. So she couldn't walk. Barely able to move around, could barely get her up and down from the table. The weight of my hand was too much pressure for her at the time. We apply the techniques that we do. And fast forward now, this would be 4 months later. And now she drives herself here and walks in by herself. It's just, so you see things like that. And it's remarkable what the human body is capable of if you just give it an opportunity to be there. And while I obviously I helped get there, but it's really her body is what did the work. I simply put it in a position so that it could work. And it's a very validating thing, but that's just where it gets fun, because you watch people reclaim their lives and their own autonomy over that which they want. And it's, I don't know, it just gets fun from there. And there's lots of stories like that. That one is it's the most recent that sticks out the most, for sure.
And I know there are a lot of people, and I've talked to some of them, that are skeptical in reference to chiropractic medicine, and I don't really have a conversation for them except for what I personally experienced, which is, to me, been amazing in the small amount of time that I've been seeing you. Mm-hmm. What would you say to someone that's just like, chiropractic medicine?
The skepticism, truthfully, in full blunt frankness, is warranted, right? Because it is atypical, right? And I find that there's a large disconnect between even the people who just have a bad taste in their mouth about chiropractic from their own experience. The way that what is being done is communicated is where I find so much lacking. And even if what the patients have been told is true, the way in which it's been presented can lead to a lot of false expectations. And so if somebody doesn't really realize how much or how severely they have misrepresented themselves and what they're doing, that's when, warranted issues arise. But what there is to say is that chiropractic works. It does, right? If you read the research, if you really want to get into it and drown yourself in people who are far smarter than I am, reading and writing and all of the statistics and the numbers that they produce, it just works fundamentally at the end of the day. But if nothing else, what we have to understand is that all that we are is because of our nervous systems. If you put your nervous system in a place where your body, again, can just do everything it already knows how to do, it will. Then all you really have to do is find the right person for you, right? Not all chiropractors are the same, certainly. But your nervous system needs what it needs in order to function. because all of us have gotten to where we are in life because our nervous systems have that happen. But the nervous system needs help too, right? If you take care of your nervous system, your body will just take care of itself. If you can facilitate the biomechanics of your spine, the nervous system will function in kind, right? Miles don't have to be unkind miles. You know what I mean? There's a big difference between 100 miles on a flat road and 100 miles in the Rockies. Like, your car is going to wear differently. So whatever state your spine is, if you can become informed about it, then at least you know.
That is a wonderful analogy. That is a wonderful analogy. Well, I want to thank you for taking the time out because I know you are super busy.
Oh, no, no
And
worries.
this has been so informative, and this is amazing. And you guys got to come and see Dr. D. He is amazing. We are here in Wesley Chapel. So just get in the car and come and see him. Okay? Do
I'm
that.
not so bad.
Thank you.
Thank you.